Hi everybody, Jennifer Blevin-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today I want to talk about the role and scope of medical assistants in your practice. Medical assistants are a wonderful asset to most practices, and I might be a little biased since I was a medical assistant and I have an active medical assisting registration, but it's true. They are generally more affordable than nurses. They are very versatile in the practice, and they just can offer a little bit different dynamic in your practice. So medical assistants need to be certified or registered in order for CMS to recognize their additions, contributions in progress notes to hit MACRA and MIPS requirements. That's something that went into effect quite a while ago now, 8-9 years ago. They need to be certified, registered in order for any of the vitals they enter, prescription refills, anything like that to be recognized by CMS to hit your MACRA and MIPS to be qualifying as acceptable to them. And I don't honestly know why. I think it's just to make sure that all these people have some standard education, and so just be mindful of that. That is super important. So if you hire someone out of medical assisting school and they haven't passed their certification, and there's like 3 or 4 entities that certified medical assistants across the country, then you need to give them a certain time frame, like within the first 2 months of being hired, 3 months of being hired, you need to have your certification, because it's really important, especially if you are trying to qualify and you participate in MACRA, MIPS, all the incentive programs offered by the government. A certain amount of information entered into those charts have to be entered by a certified entity, medical assistant, nurse, etc. So if they're your only medical assistant, it might be more important for them to be certified sooner than later, depending on the information being entered into the progress notes and medical records, versus maybe you have 2 or 3 other medical assistants that can do the bulk of entry, and you will hit that metric with that percentage because of them, and it's not as vital for them to get certified as fast. So you just need to kind of look at that internally with your practice, what other staff you have that's certified, what's the percentage of amount of things that are being entered and for how long, and go from there. So medical assistants are not licensed like nurses. They cannot work independently under their own license. They are certified, they are registered, but they work under the provider's license. They have to follow standing orders. They cannot diagnose, they cannot prescribe, and you would want to check with your specific state's requirements, guidelines for medical assistants and their specific roles and scope of practice in which it applies to you. But they will never be able to diagnose, they will never be able to prescribe. It is always a good idea to have standing orders in which they work under, because then it's very clear for everybody, right? It's clear of what their expectations are, it's clear for what the provider is expecting of them and what they need to be responsible for themselves. If you were to get reported for some reason or have a compliance issue, it's all set out so that it should be that everybody's on the same page. It also helps if you need to reprimand somebody, if you need to help with reviews of your staff when it comes to their, raises and yearly reviews. So, it comes in handy for multiple things. Medical assistants can remove sutures often. They can help with, obviously, rooming patients, taking vitals, calling patients back, giving injections of certain things like vaccines and like vitamin iron shots, vitamin D. I mean, there's just so many things. Vitamin B, there we go. And there's just so many things they can do, but it has to be within their own scope, and it has to be underneath that provider and making sure that they are being closely monitored. Like I know in Oregon, medical assistants can't draw blood or do many things unless a provider is in the building. Like they can't be doing things with the providers on vacation because, that puts them at a high risk. If something were to go wrong, nobody's there to help. They can't diagnose, they can't assess, they can't treat. So it would be a bad situation. So it's very important that your medical assistants understand this. And I think by having that standing orders and expectations written down, it really makes it clear. The thing about medical assistants is they don't need their own liability malpractice insurance. They don't need professional insurance. Because they are covered under the doctor is responsible for them. So it goes under the doctor or the mid-levels insurance if something were to go wrong and the patient files a malpractice report or malpractice incident, it would ultimately go to the provider, not the medical assistant. And that's why it's important that you have really good malpractice insurance, and I've done some videos about that, but also your liability insurance for your business is also important because some things may overlap into that. So malpractice insurance for the providers covers medical assistants, and then you want to make sure you have your business liability insurance in place in order to cover the other stuff that maybe malpractice doesn't. But medical assistants are very helpful, very useful, and they do have to keep up on their continuing education, just like other entities in healthcare that have a certification or license. So like for me, I have to turn in my CEUs every 3 years. I think I'm at 60 hours every 3 years. And, they put a certain limit of how many hours I can get in certain things, but that's okay. And, just because I don't work as a medical assistant anymore doesn't mean I don't want to keep my skills up and my knowledge and my certification. So I still do it because I never know when, I'm working in a practice, I can step in, I can help back up that mid-office staff if they need me to room patients, give vaccines, draw blood, do whatever. And it's peace of mind for the owner and the manager or, whomever that, I'm certified, I'm good to go. And I understand what the standing orders are. So I just kind of move forward. But anyway, medical assistants can also be very helpful at the front desk. It's good to cross-train in any small private practice. I've said that in multiple videos. And medical assistants usually in their programs do get some front office training. So as long as you let them know that that would be expected of them to be cross-trained and occasionally have to work the front desk if someone's out sick or if you're shorthanded for whatever reason, I think it's very reasonable. And their wages aren't usually so high like a nurse that you don't want to waste quote paying them just to work the front desk. And I know that sounds really bad because the front desk, in my opinion, is the most important part of a practice. And they get underestimated and underappreciated more than anybody else. But a lot of people have that mentality. I've heard it a ton. Well, I don't want to pay my nurse to work the front desk, like it's below them and they pay them. And I get it. Nurses get paid a lot of money. They deserve it. They work under their own licensure. They have more skills. They have more training. But medical assistants kind of are the in-between, and it allows a little bit more peace of mind for owners to have them work at the front desk and not feel like they're throwing money away just having them work the front desk. So anyway, if you have any questions or comments about medical assistants and utilizing them in a practice, please leave that in the comments below. Smash the thumbs up button if today's video was helpful, and subscribe to my channel if you haven't already. Thanks so much, you guys. Take care of yourselves. Bye-bye.